A TBI patient is up to 3 times more likely to suffer from neurodegenerative disease. When you combine neurodegenerative disease, it's the second leading cause of death worldwide. 80% of those incarcerated in the US, 80% of males incarcerated in the US have a traumatic brain injury. When we talk about females incarcerated in the US, it's 99%. 54% of the world's homeless population has a traumatic brain injury. If we start treating traumatic brain injury more efficiently, we will improve some massive socioeconomic problems. VIVI is more about a holistic approach to healthcare, specifically brain health. I've had multiple TBI incidents. I've buried 3 times the amount of my military friends to suicide than I have to combat.
Nobody really knew or talked about traumatic brain injuries. They had the buzzwords, shell shock or this or that. You were feeling that like it was a rush, like it was rad, like you were doing your job.
We've been taught for the last 30 or 40 years that head trauma is not really that big of a deal. But now we're finding out that even a mild concussion can present psychological symptoms up to 17 years later.
I could tell you 3 hours prior to a storm coming in because of the headaches I would get. Emotional regulation is a huge one. Depression, memory issues, huge memory issues for me.
There is no one solution for each individual. The gold standard for the treatment of complex neurological and psychiatric disorders has been pharmaceuticals. They still play a role, but they play a role in tandem with other emerging technologies.
So we use advanced diagnostics, brain QEEGs, blood labs, gut health assessment, and what we really want to focus on is being a partner in our patient's health by providing fully informed patient consent, building a relationship of trust, and also understanding that there's a give and a take to this relationship. We're both got to buy into this.
What I noticed the biggest thing was my frustration level became less and less and less with each treatment. In fact, one of the best nights sleep I had was after my fourth day of ketamine. I had a sleep monitor on, and I think it said that I had like 91% efficiency in sleep. I've never heard of that in my life, at least.
Where we're seeing the biggest thrust in the treatment of traumatic brain injury are full body processes. That's everything from muscle health, dietary health, gut biome, heart health, and brain health. How VIVI is pulling together and banding all these different capabilities into one to address how they're all interconnected is really where the science of treating traumatic brain injury and complex psychiatric disorders is really centered.
The reason we're crowdfunding is that this is really a societal responsibility for all of us. If we want to improve the quality of care, not just for ourselves, but for the future generations, we all have to kind of take some part and some responsibility in that. The goal for this crowdfunding is to build a center of excellence for brain health and bring in providers that also believe in more effective brain health treatments. The first clinic I would like open within the next 6 months. We already have the provider network established. This is really about bringing everybody in-house and eliminating most of the patient pain points. By backing VIVI in this crowdfunding, you are really putting your trust in changing the way healthcare is offered to us today. As a collective whole, the impacts on society we would see over the next 10 years if we could switch our healthcare model would be incredibly drastic. It would change the way we look at society altogether.